Hello, and welcome to today's episode of Uptime, the podcast from .med Healthcare Business News, where we speak with experts about the key issues shaping the medical equipment industry. I'm your host, Carrie Stevens. As a reminder, Healthcare Business News is free to read. So if you've not already registered, head to .med.com/news and sign up after the podcast. Now, it's my pleasure to introduce today's guest, Peter Shen, for a timely conversation on healthcare AI reimbursement and the proposed Health Tech Investment Act. Mr. Shen is the North America head of digital health at Siemens Healthineers with a background in biomedical engineering and leadership experience at Johns Hopkins University. He's also testified before Congress on the role AI could play in healthcare delivery and has been closely involved in discussions shaping emerging federal policy around digital healthcare technologies. Peter, thanks for joining me today.
Oh, great to be here, Carrie. Looking forward to our conversation.
Too, this is so interesting. And I know the audience members will agree because AI is everywhere, but let's just get into it. Okay, so at a high level, what's broken about how Medicare reimburses healthcare AI today, and why does the Health Tech Investment Act matter now?
Yeah, the Health Tech Investment Act is actually a real critical piece of legislation for how AI is really going to impact healthcare. And in particular, I think, as you mentioned earlier in the opening, I mean, AI is everywhere right now. It's affecting us both in our personal lives and our professional lives. It already is having a profound impact also within healthcare. So many patients don't realize it, but a lot of the different, when they go in for a diagnostic exam, let's say on a CT scanner or MRI scanner or whatnot, there's AI algorithms that are built into those devices that are helping make sure that we get the most pristine image generated from those imaging devices there so that those clinicians can help kind of determine what's wrong with that patient. So AI is already playing a significant role within healthcare. Now, the big challenge that we have today is how do we make sure that patients, regardless of where they live, who their doctors are, where do they go for care, have access to this amazing technology that's really changing how we conduct healthcare going forward. And the Health Tech Investment Act, it really is trying to find a way that we can make sure that this new and emerging and influential technology is accessible for providers so that they can then offer these great services to patients. And that's the key component here, is really to help kind of drive the overall adoption of artificial intelligence within healthcare, and doing it with in a way that really motivates both the providers and the patients to want to have access to this technology.
Great. So after 6 appearances before Congress, which is incredible, what do lawmakers still underestimate about what it takes to deploy AI in real hospital settings?
Yeah. There's several challenges. I think it's no question now that after all these years here, that now that we've seen AI introduced within the healthcare space, and in particular with regards to the kind of the medical imaging space. So as you can imagine, when AI first was introduced within healthcare, a lot of the focus was in medical imaging, and for obvious reasons. So the same AI algorithms that we know in our personal lives that we use when we take a photo, for example, the same AI that says, "Oh, this," when you take that photo, it says, "Oh, this is a picture of Peter. Let's find all the other pictures of Peter," all that type of stuff. Those same algorithms were used rather than training it on pictures of Peter. We said, let's train them now on, abnormalities within the heart or within the chest or the lungs, or a mammography exam or something like that. So very early on, a lot of the different AI algorithms that were created in the healthcare space were really focused around medical imaging. And in fact, Carrie, I think today now the FDA's cleared over, I believe, more than 1,300 different medical devices that have some sort of AI component with it. So, and the vast majority of those FDA cleared AI algorithms are all focused within medical imaging. Again, because of what we talked about historically here. So, so what's really great here is that you've got now this technology that can help clinicians identify kind of these kind of abnormalities a little bit faster. They're able to, let's say, characterize them a little bit more, be able to measure them, quantify them, maybe help the clinician determine the severity of that abnormality, so that he or she can then make a more kind of informed decision, diagnostic decision on what to do with that patient. We're also starting to see now these algorithms also play a role in terms of the therapy or the treatment of patients as well. So a great example of that is in the area of oncology or cancer care. Patients who unfortunately are diagnosed with cancer, many of them actually qualify for radiation therapy, to be able to use radiation to kind of hopefully kill that cancer there. But certainly we want to make sure that radiation beam kills that cancer, but then none of the healthy surrounding tissue around those cancerous tumor. So what clinicians have to do is they have to do this painstaking process of essentially tracing out or carving out where the targeted tumor is, and then making sure that all the tissue, that healthy stuff around it, is not shot by that radiation beam. And if you have ever tried to trace something out on a piece of paper over multiple pieces of paper, it's multiple dimensions here, so it's a very tedious task, especially with these cancerous tumors, which are not uniform in shape. So they're not perfect spheres, or they're not perfect cubes or anything like that. So to kind of make sure that you get all these different ridges and different kind of odd shapes that you have there, takes a lot of time. And that unfortunately delays the treatment for a lot of cancer patients, because we've got to take hours, maybe even days, to kind of get that proper treatment plan in place, so that we kind of protect that healthy tissue. Now you introduce a technology like artificial intelligence, and again, very simple algorithms that we talked about earlier, that can do pattern recognition and everything, and it can essentially kind of trace out that cancerous tumor in a mere matter of seconds, and then feed that tracing into that radiation therapy machine, so we can actually start to begin therapy for that patient almost immediately. So rather than patients waiting weeks or months for their treatments to start, they can actually start them in a matter of hours or days. And certainly as we continue to use that radiation to kill that cancerous tumor, that tumor changes shape and form, we need to retrace it again. Again, having a tool like AI and AI algorithms can do that in a mere matter of seconds, and we can continue that treatment. So huge, profound things that are affecting the patients here. So the big challenge, though, that we have, Carrie, is that even though we have over 1,300 different AI algorithms that are FDA cleared, which is wonderful, if you look into it more, the vast majority of those algorithms are actually don't have any sort of reimbursement associated with it. In fact, there's only a small handful out of those 1,300 that actually receive any sort of reimbursement, and most of them not to the same level of cost that it takes to actually procure any of those algorithms. So this becomes a challenge, because if now I'm a providing institution, I'm a hospital here, and I see this wonderful technology that has profound benefits, like we just talked about, yeah, whether it's in terms of treating cancer patients, or identifying abnormalities, yeah, during a diagnostic exam or whatnot. So I want to give this technology to my patients here. And in many institutions, maybe that have kind of the financial flexibility, like large academic institutions or large health systems or whatnot, they can afford this technology and take the chance that maybe this technology doesn't have any sort of associated reimbursement with it. They can make that investment. But the bigger challenge is then more for kind of your smaller community hospitals, and maybe your rural hospitals and clinics and whatnot, or smaller health systems, where they're a little bit more financially challenged, and they have a tougher time justifying that investment in these AI algorithms, because they might invest in that algorithm, but it may or may not get any sort of reimbursement. And taking that chance on whether it gets reimbursement or not could be difficult. Whereas I could take maybe that same monies and be able to buy more beds for my patients or anything of that sort. So that becomes a big challenge. If you dig into it a little bit more, part of the problem is that kind of the Center for Medicare and Medicaid, so the CMS, for the algorithms that they've actually provided reimbursement for, they've done it in different reimbursement pathways. So some of them get reimbursed because it's a new technology and they say, hey, this is really profound. It's changing the way that we're looking at healthcare, so we should provide reimbursement for it. Some other ways are they use existing payment pathways that we have. So, hey, you're doing a certain type of MR brain exam. That this is we do reimbursement for that. Let's also throw in a few extra dollars because you're utilizing this tool. So the problem is that there is no sort of consistent way that we're approaching how we're doing a reimbursement. So that adds to a lot of the confusion and uncertainty as a provider on whether I should make that investment. So in many cases, a lot of institutions they'll actually try to request reimbursement for what they're doing, and kind of rolling the dice to see whether they actually will get it or not. And that uncertainty again is actually what's holding back some of the adoption of these type of tools, because as folks kind of scrutinize over their finances here, they try to figure out, well, if I spend all this money to buy this technology, but I'm not sure if I'm going to get any sort of payback on that technology, should I actually make that investment or not? And that's where we see the big challenge right now. And this is also where we see the opportunity for our leaders in Washington to actually be able to make some sort of influence and create some sort of predictability around reimbursement for these technologies.
That's so interesting. So I want to get into what I'm guessing has been kind of the other side of this. I mean, obviously, you're for the reimbursement, which makes total sense. But people that are against this, what are they saying? Is it because they're afraid that this AI is going to replace radiologists? Is that where this is coming from?
No, I think it's I think some of the challenges around reimbursement is the fact that certainly, one, there's only there's a finite pool of money that can be, utilized to reimburse for a particular exam that's being done. And so there's a lot of concern that, okay, if you provide reimbursement for like this AI technology, you might have to take reimbursement away from other things that we should be reimbursing. And certainly, I think, as your listeners know quite well, we've seen just a general trend in terms of reduction in reimbursement on the different types of exams that are being done, especially in the diagnostic part of healthcare as well. So there's a lot of concern that why all of a sudden do we need to provide reimbursement then for this kind of a thing that we call AI? Yeah, when we're already struggling to get the proper reimbursement, for some of the procedures that are being done today as well. I think the other challenge in this space that whether it's the folks in Washington or even in our industry are looking at is, we're talking about artificial intelligence, a pretty simple form of artificial intelligence, which is kind of utilizing pattern recognition and kind of algorithms based on that. But as we all know here, AI is a continuously evolving type of technology, and topics around kind of things now, agentic AI, autonomous AI, all these other things that are happening here are evolving a lot faster than any sort of kind of policies or procedures could be in place, let alone any sort of reimbursement as well. So other folks are kind of saying, well, wait a second, like if we do something here, we're already behind the eight ball because we're already, we're all also talking about generative AI and all these other AI things. So do we then need to look at reimbursement for these AI solutions as well? And what does that mean? Again, finite amount of money that we can that we can afford that type of stuff here. So I think that creates a little bit of uncertainty as well. And of course, we talk about requesting kind of CMS to make things more predictable from a reimbursement standpoint. That doesn't necessarily guarantee that kind of the private payers or anything of that sort will also follow suit as well. So there's a lot of open questions, yeah, still in terms of reimbursement and even the way that we would do kind of the reimbursement as well. So.
Okay, so from your perspective, what separates AI tools that should qualify for reimbursement against those that shouldn't?
Yeah, it's a great question, Carrie. And I think again, we look at these type of clinical AI tools that specifically are generating kind of more information that allows that clinician to make a more informed diagnostic or therapeutic decision. So what's even characterized in the health Tech Investment Act is that we call these things kind of algorithm-based healthcare services. So not even kind of AI itself, but really algorithm-based kind of services that are actually providing the service of additional information for that clinician that he or she might not be able to get on their own. Yeah, so if they and again, if we take a look at the classic example of medical imaging, and if I'm looking at an image here, um, I could probably spot abnormalities that are quite obvious and wouldn't necessarily need an algorithm-based healthcare service or an AI tool to be able to help me with that. But where these type of tools become helpful is when if I'm looking at that same image, but I've got something where I'm not completely certain on whether this is abnormal or this is maybe, or something that's, significant or not significant here, the ability to use these algorithm-based healthcare services or these clinical AI tools to actually be able to quantify this unknown, to be able to characterize it, yeah, to give me some more concrete information about the severity of that particular abnormality that helps me then make a more informed diagnostic decision that says, oh, yes, this is bad. This is something that we need to look at, or to say, okay, that was not something to be worried about. Those type of tools that really help that clinician to make that determination. These are the ones that we're looking for or suggesting that there should have reimbursement towards. And if you think about that hopefully makes sense. Yeah, we want to reimburse tools that are truly helping that clinician, in this case, make a strong, and more informed diagnostic decision.
Well, that makes perfect sense. So, if this bill passes, what should we be watching out for the next 5 years to know, whether it really has moved the needle for patients and providers?
Yeah, it's a great point, Gary. So, you know, what this bill is asking the folks within CMS to really kind of create kind of more predictable and consistent way of reimbursing these type of technologies. It doesn't necessarily say, hey, this is the way that you've got to do the reimbursement. You've got to create this pathway or this or that. It's really advising CMS, hey, let's try to create some sort of consistent and predictable way of doing this. Now, one of the things that we at Siemens Healthineers and other med tech companies have suggested to CMS is that, to your point, we don't know really the true benefit of these solutions. Yeah, if I put this AI tool in place, how do we actually quantify or measure the impact that these tools really have? Yes, we talked about examples where maybe patients get treated earlier or patients get their diagnosis earlier, but we need to do a very comprehensive study to really kind of figure out what is the true impact of this. And one way to do it is to kind of eliminate the variable of cost associated with this. So if you take cost out of the equation, so it doesn't become an impediment to the adoption of this tool, can we then actually look at how do these AI algorithms have a downstream effect to the overall cost of care for that patient? So one of the things that's been suggested with working with CMS is that, why don't we could do some sort of temporary payment over the course of time, like you suggested, maybe it's 5 years, maybe it's a couple years or whatnot, where we eliminate the cost factor from these tools that enables then providers to be able to adopt these tools with hopefully relative ease, and then we observe over this time period, what is the downstream effect? Yeah, so are patients getting diagnosed more accurately? Yeah, is there savings to the health system because we're doing earlier diagnosis, because we're treating patients earlier because of these type of tools, and really quantify what that downstream effect is over that temporary payment time. Once that kind of evaluation is done, then we can work together with CMS to establish a more permanent payment or a permanent code, yeah, as folks are familiar with, that actually really helps quantify what that downstream effect is for these AI algorithms. So this is again one way to help the industry, help healthcare really quantify how impactful these AI solutions are.
So before we wrap up, I want to go back to the point where you're making about the rural health systems, because I think that has been so much in the news lately. How these, especially after COVID, a lot of them are closing and just how they've been hit by so much of the healthcare burden. So, how does today's unpredictable payment model hit rural and underserved hospitals differently than large health
Yeah,
systems?
and it goes back again to kind of this financial flexibility, Carrie, and the ability for these providers in these kind of rural and underserved populations to be able to make the investment into these emerging technologies. So certainly, I think again, everyone's aware of the potential AI has within healthcare, and again, we're seeing more and more examples of how, in a very positive way, AI is making an influence and helping the patient here. Now, when we look at kind of these non-communicable diseases, these chronic diseases, whether it's cancer, yeah, um, uh, you know, heart disease, stroke, all these type of things, they don't just happen in the big city next to the big academic institutions. Yeah, they happen all over the country, in the rural populations, in the underserved populations as well. Now, is there for those providers in those spaces, again, where financial flexibility might not be there. And if there's uncertainty in terms of whether if they invest in a technology like AI, that they might or might not get reimbursed, any sort of reimbursement for it. That uncertainty is causing a lot of those providers in those areas to say, well, wait a second, the money that I could spend on AI, I probably should use that money to kind of support some other services or other things that I need to do to take care of my patient population. And that's unfortunately where we're seeing a little bit of the discrepancy, especially in kind of that rural or underserved population, which one could argue probably needs this technology more than maybe in some of the more larger academic or larger health system type of organizations, to be able to have tools, AI tools that help, with screening their patients, yeah, and identifying patients who are maybe more susceptible to certain, cancers or whatnot early on with a tool, with an AI tool that helps with early detection, with tools that are able to help put together, therapeutic treatment plans faster so that they can go to take care of their patients, to allow those patients then to receive the care at their kind of local community hospital rather than having to travel to any sort of large academic institution in the city or whatnot. This is where the opportunity to allow patients more accessibility to this technology comes into play. And again, as we've seen historically, the motivation for providers to adopt technology, a lot of it comes from reimbursement. Yeah, we saw that in the past, like with electronic health records or whatnot. We do also see, potential opportunity here again with AI or algorithm-based healthcare services, where you tie that with reimbursement, eliminate the variable of cost from the equation, will drive up the opportunity for adoption of this technology and ultimately accessibility for the patient.
Is perfect wrapping up. But I have one final big picture question for you. I ask every guest this, but so what's keeping you up at night, especially when we think about AI and healthcare more broadly in 2026? Yeah, what's keeping you
Yeah.
up?
Yeah, I think, Carrie, there's a couple things. One is, as we've talked about throughout this podcast, again, the adoption of these technologies. I think it's no question that AI is amazing. It can do all these amazing things here. So it's less about what it can and can't do, and really more about, like, how do you practically adopt these things? How do you and we talk about reimbursement as one motivator here. How do you also then integrate these technologies into kind of your routine clinical workflow? So when a patient comes in for their normal exam here, how do you make sure that these technologies are integrated into that physician's world, so it doesn't become an extra task or something that's cumbersome for them to utilize here. So the ease of adopting this technology is something that we're constantly thinking about. The other piece is that how quickly is, and we touched on this, how quickly this technology is evolving. Yeah, so we're talking about reimbursement for algorithm-based healthcare services that are very very clear and obvious, but as we've talked about, AI is now evolved to all these different dimensions, whether it's generative AI, authentic AI, autonomous AI, these type of things that are happening, and the technology is evolving quickly. So one of the challenges is that we I hate to see how slow we are to try to figure out, what are the guardrails that we want to put in place? What are the ways that we want to, drive adoption when this technology is constantly evolving and new things are coming up and new ways, new innovations, new innovative ways of utilizing this technology are occurring that could again have even more profound effect within healthcare. So these things, so it's a little bit of a catch-up game, I think that we're constantly playing with, especially with this technology here, and these pose some challenges for us. So again, reimbursement is only one aspect of it, but there's a lot of different components that we've got to figure out here, and trying to figure out those components and make this technology accessible to patients. I think that's something that is always top of mind for me here at this time. So.
Thank you, Peter. I know I learned so much, and I know our audience members will really learn a lot too. And to our audience members, thanks as always for your listenership and be on the lookout for the next episode of Uptime. Take care.
Thank you so much.